computer. So, hey Josh, how's it going? Welcome to the podcast. I'm glad we could finally connect.
Thanks for having me, man. Great to connect.
Cool. So let's get right into it. And based on you're on the West Coast, I'm on the East Coast, and I'm a little under the weather. Just took some medication, so I
Don't
might
fall
be out.
asleep on me.
I'm, I might be out by like 10 o'clock. So let everybody know who you are and what you do in our field. I know you got a book and that we'll get into. We'll talk about the book. So just let people know who you are.
Sure. So I'm Josh Cutler. I'm a licensed clinical social worker. I'm based out of Seattle. I work for Providence, which is one of the largest health systems in the country. We're on the West Coast mostly, and also do some private practice work as a therapist.
Okay.
So I've been a social worker for about over 10 years now, but I've worked in healthcare for almost 20 years. But I finished my master's in social work from the University of Washington in 2011. So I've been at it a while. And some days I'm kind of amazed I've stuck with it this long, but I'm kind of getting in the groove now that I'm feeling pretty good about. So I think I'm gonna continue on. I know some of my colleagues that maybe have worked in the field don't always continue on, but I'm finding that I'm having great opportunities to serve my community and work on things that I care about, and I've been really feeling grateful to have had the opportunity to share my story in my book, and so I'm enjoying the ride right now.
Cool. How are things in Seattle and in Washington? Just in terms of COVID, like or just like anything newsworthy and related to social work. What's going on in the state?
Yeah, so in Washington State right now, I mean, COVID in King County, I think we were, which is where Seattle is, it's actually, I think we were one of the highest vaccination rates in the country. It was like 80 or 90%, but we're not necessarily immune even then to having some issues, and some folks that aren't vaccinated or have gotten sick anyway.
Mm,
And and certainly, like, it's interesting, I used to have an office in downtown Seattle, or I still do, and I mostly work from home, but when I go down there, it's just like totally dead except for homeless people and like boarded
mm,
up storefronts. And so, not that there wasn't boarded up storefronts occasionally and an issue with homelessness before, but it's just so much more apparent. And I think the radical inequality of our country right now, and in our city, especially since we have all this tech here, there's all this tech money, and it's just really startling to see all the poverty and drug abuse and other things that go along with homelessness that are right there kind of on the street, and then all these big Amazon towers,
mm.
and all the wealth that's created by that. Guys driving around in Ferraris and stuff that are younger than me. So that's kind of surreal. But yeah. So Seattle, Washington State. I think every state's got its own set of challenges. But
Yeah.
I've lived in this area for most of my life. I was born in California, but I moved up here when I was one, grew up on an island. It was more rural, so I'm from a rural area, Whidbey Island, which is just northeast or northwest of Seattle.
Okay.
And then I've lived more in the city area. I live in the suburbs now in a place called Bothell, and it's a place that I'm settling into, I think, for the long haul. We live in a split level now. I drive a minivan, get my kids to school, and I'm kind of doing the middle-aged guy thing in the suburbs. So
And
that's
there's
me.
there's nothing wrong with that. Now how now no being no I did a couple episodes toward the end of season two. No dads in the field is not there's no thanks to Twitter and Instagram, but really Twitter. I've noticed more mental health professionals and social workers who are dads and balancing, you know, doing the social work thing while trying to parent, which is it doesn't get talked about it enough because there's not a lot of males in the field to begin with. But no, I did a
Yeah,
couple episodes of men in how you balance being being father, fatherhood and social work. Now, how do you balance doing what you do in the field of social work and then coming home with to two kids and just being dad and being present for them.
yeah, that's a great question. I would say some days not very well. Some
Mhm.
days I'm doing okay. um, and this is a time, frankly, right now, I'm making some changes in how I'm spending my time at work, and I'm rearranging my role a little bit to be able to not be working so hard. I've been on a bit of a um, corporate ladder at work. I'm a senior clinical manager now, and I probably director would be the next step up, but I decided I'm going to step back from that a little bit, and I actually just took a part-time role so that I can focus on building my private practice a little bit and doing some meaningful work in the health system and keep my benefits, but really be able to focus on my health and my family more. I lost my dad to a heart attack a few years ago, and he was just 63, and kind of seeing, I'm headed down that path if I don't do some things differently. And also too often I find that, especially working from home, I'm around, so I see them, and I can even come up maybe between clients when I'm seeing people for psychotherapy. I have an office downstairs. Um, but sometimes when I'm just really fried, I'm I might be around physically, but I'm pretty vacant, or
Mhm.
I'm kind of grumpy if they're doing something that's causing trouble. Um, and I was um, talking with someone recently that was going through a divorce that described the husband as either being kind of vacant or kind of angry. And I thought to myself, well, that sounds familiar. I think I have more range than that, but on my worst days, that certainly can be the case. And I think especially with this work, I mean, the um, level of secondary trauma that
Mhm.
we experience, let alone burnout and sometimes depression and other issues, which I talk about in my book. I've certainly gone through, all of those things, have my own trauma, but then the number of stories I've heard from people, it's part of me. I can't let that go. And then there's times, I hear horrible stories, maybe even of things that have been done to women, and then I come home to my daughters, and that's just scary to imagine there are going to be women in the world and these things could happen to them.
Right.
And it's hard to show up and be present sometimes. But I think I've been working doing these exercise classes in the morning. That's been making a difference, and riding my bike, and starting to do some mindfulness. And I really like cooking for my family. That's something that is a great way to show the love and then sit down and share a meal. And so finding ways to kind of work through some of that stress, and make time to be together. We got a vacation plan next week, and
Okay.
taking the minivan out on the road. So we're looking forward to that. So those are all things that I do to find balance, but it's been tough this year, man. Because whatever extra capacity I feel like I had, or I think any of us had, especially that work in this field, it's been pretty much slashed by COVID. And I spend a lot of my time talking with nurses and doctors. That's a big part of my job, being a counselor for them. And it's taken its toll for sure.
Yeah, absolutely. No, yeah, you said a lot, and I'm glad you brought up doing things for self care and some exercise, and my condolences for your loss of your dad. I lost a parent last year myself, and that's is tough. Like,
Yeah.
it's the cycle of life. Like, ourselves and our parents. That's kind of quote unquote normal having like your parents go, but it's not easy, and nobody is like there's no book to be like, okay, how do you deal with this? You just like it comes, and sometimes you have your good days, you have your bad days, and it's just one of the painful things that we go through as human beings. So no,
Yeah.
again, my condolences, no, to you, and just no, I'm glad you take some self care, do some exercise, cooking, and doing all these things, and just being self aware that you experience this stuff, and like I need to make a change, no, for myself, because being parents, and if you're in a relationship, you're married, it kind of like, and especially a long term relationship, you've been together for a while, you kind of at times lose yourself in that relationship, and it's like you're not the same person, and then just days go so fast, and it's like one day leads to the next, and like it'd be like 2 weeks go by, and it's like
Yeah.
nothing, and it's like that happened like last week. No, it happened like a month ago, but then
Yeah.
just days just blend, and it's just
Yeah, that's for sure. Yeah, I've been married 15 years next week. It's amazing how quick it's gone.
yeah,
Yeah.
that's amazing. How old are your kids?
So they're 4 and 9. Yeah.
You got
Yeah, girls. So
two
yeah,
girls. Oh
I have
man,
all brothers, so I'm still figuring it out. But
it's
my mom moved closer, so grandma's around a lot. She's delighted to have little girls around after raising all those boys.
yeah, man, it's tough as a dad. I got my 9-year-old, and for a while it was just me, like just trying to do her hair in the morning, and like I needed like at least a half hour, 45 minutes just to do hair alone, and even like when she went to pre-K and kindergarten, luckily her teachers were like cool with me, and like and help me out with the hair, and like teasing me a little bit, but
Yeah. Oh man.
but yeah, man, it's tough. When my daughter got curly hair too, it's like, couldn't you have like straight hair like me? Like I used to
Yeah.
have
Yeah.
straight hair, and it's just like,
Right.
oh man, it's just like you gotta wake her up early, just strictly just
Wow.
for the
Wow.
hair.
Wow. Well, my girls is pretty straight. And they've just been letting it grow with COVID. It's like way down their backs. My
Okay.
little one had a little cute bob before COVID, and now it's like almost all the way down her back. It's
Mm,
crazy.
yeah. How are they handling no COVID? I know no kids' mental health has been a huge topic ever since the
Mhm.
pandemic started, and so how's it been for
Yeah.
your kids?
Yeah. Well, I feel like we're pretty lucky. We were fortunate enough to be able to buy a house last year
Okay.
and move to a new school district that we felt like was better able to support. Our daughter has some special needs, and to be able to support some of those. And we found actually that being on camera for her was really helpful. I mean, socially, she was able to warm up a little bit with people, and being able to kind of mute and unmute was helpful, and get to know her classmates a little bit that way. She's pretty independent. She's really into school, and she's 9. So it's sort of that sweet spot. I think if she was a teenager, we'd be in trouble, or if she was a lot younger. So she was able to keep up. So I feel lucky about that, and really enjoyed. I kind of miss having her. She's been at summer camp, and I'd see her during the day, and we'd have lunch, and like we used to rush off to school half asleep, and I'd drop her off and barely say anything, and then I'd see her late at night. Whereas this last year, I saw her like every day, like,
Mm,
and when sometimes she had a break, we'd go for a walk or a bike ride. It was cool, and we joke that she and my wife were like my coworkers. I'd see them in the kitchen, like the break room, and then my youngest, it was hard at first, especially when we started. She goes, my wife and I both work full time,
mm,
um, and the daycare closed for a little while, but then preschool reopened and she was able to go, but they had to wear masks.
Mm.
But we're used to it now, but it was weird for at first, just like I'm dropping my kid off wearing a mask all day. Um, and now, with my other daughter will probably go back in person and wear a mask. And I mean, she's pretty disciplined about it. Whenever we go anywhere, she's like, "Put your mask on, Dad," and it's on me about it. So I would say my kids are doing, okay, but would say have a lot of privilege in that we work from home. We have some flexibility in our schedules, um, and so we're able to get takeout. My mom comes over and helps us out. But I've also, as a therapist, seen quite a few families with kids, and know that this has taken a toll in that just people's routines were disrupted,
Hmm.
their ability to connect socially was disrupted. There's just so many things, and I think also kids often it can be sort of like the canary in the coal mine, like um, I'm the last one to blame a parent for a kid's issues, but kids are sensitive, and when parents are stressed and having their own issues, kids pick up on that and they respond, and so it may be that they act out or they withdraw. Like family systems are real, and
Yeah,
so
absolutely.
so I gotta check myself when okay, something's going on with my kid. How am I handling my own stress? Um, and so that's often in my work with families. I'll maybe they'll come with the kid being having some primary issues, but often work with the family of how can we overall help the family to um, be more connected and have more strategies for working through some of the stress. And too often these days the solution can just be we all stare at our separate screens. and,
Exactly.
um, and frankly, that's what my kids are doing right now, staying quiet well so I can do this with you. But we'll probably go ride bikes or something later because it's still early here. Um, and so I think being intentional, and that's where just having some time, and that's something I'm working on, kind of again creating for myself, like not wanting to repeat what the history with my dad, who I loved him dearly, but I didn't see a whole lot of him because he worked a lot, and then
Mm.
his health was not in really great shape, and he died early. So I'd rather have a different story for my kids and be around for the long term.
Yeah, absolutely. I think that's important. That whatever like our relationship was or is with our parents, that take the good with the bad, and like you want something better for your own kids, whether it be just emotionally or even like financially. That there's so much stuff about financial literacy and all this stuff that out there on the internet currently, and our kids will have like the head start that maybe you and I never had, or had the ability to, or like our parents didn't have that education. So now that we have it, and now I'm always like trying to do something, at least on a financial aspect, because I
Mhm.
spent a lot of time during the pandemic, learning. I started investing in the stock market, and crypto's been a big thing, and I bought a house myself. I bought a house this year, so it's like
Nice.
all this things and trying to put things in practice. And my kids actually make fun of me. It's like, you watching another financial, like they see me watching like Yahoo Finance on TV, or they're like or something, or a Zoom call, and it's about like stocks and finances, and the housing market and things of that nature. Like, you watching that? Like, yeah, like I'm trying to you know do what I can now, and that's for you, for your future, that you don't have to be like busting your ass, and any money that you may have like in the future, that you do when you hit 18, 21, you do whatever the hell you
Yeah.
you want with it. So whatever
Yeah.
whatever is there. So whether it be if you want to use it for college or whatever, just like once you hit the 21, like hopefully I'll still be around by then, and then like help you guide that. for you, but I'm trying to do stuff now for your future while you guys are still young. So that's that's important. At the same time, yeah, be mindful of their feelings. Let them know also, like, yes, you guys are siblings, but like you're your own person. You're your own person. You got your own feelings and stuff. You got your own friends, and you got your own interests and stuff like that. And it's been it's taken a little toll since they've been home for a year and a half, not being classmates, and
Yeah.
on top of being siblings. And
Hmm.
hopefully when they go back to school, hopefully in person, unless something crazy happens here in Delaware between now and the next 3 weeks. They'll be
Hmm.
going to school in person, for the first time in a year and a half, and see how they do. Hopefully, I already seen all this stuff, like online, and like former classmates and friends I talked to. They already had like school shutdowns already after like a week or two of school. So it's crazy what what we're dealing with currently.
Yeah. uh yeah, one day at a time. um
Exactly. One day at a
that's how
time.
I feel right now. One day at a time. Yeah.
Yeah, absolutely. So and I really want to like stress I'm really glad that you have this mindfulness of you know doing what you need to do, not only for yourself, but especially for yourself, but also for your family, and understanding that you need to unpack some of the stuff and make sure that you're doing what you need to do, for you, and then doing stuff for your kids. But that at the same time, you're using your own experience and helping your families out during your own sessions, and kind of unpack all that whatever they go through, and just we shouldn't be judging our clients anyway, even though sometimes it kind of slips every once in a while. Uh, but at the end of the session, I'm like, what the heck was that? But during at the heat of the moment with with the clients, just try to unpack and make sure, and just really how can we help you as the whole family system, or maybe it's not the kids that having issues, it's the parents. And like you mentioned before, it's like, okay, what's going on with you that it's
Yeah.
affecting everybody else. So it's great
Yeah.
that you pointed that out.
Yeah. Yeah, and try to do it in a way that's not blaming or shaming, but just like, hey, we can, things can be better. Let's figure this out. So yeah.
Yeah, because this Zoom, the school on Zoom is not it's not working for a lot of
Yeah.
parents. It's
Yeah.
become more stressful than anything else. So let's go into your book that you wrote. So the listeners know about it, how long you wrote it, what's it about, and go from there.
Yeah. So my book is called The Day Hospital. And actually, the second edition just came out in June. That was kind of a soft launch, but I'm really starting to promote it now. I've got a big event coming up at Town Hall Seattle at the end of September, but it'll be live streamed for your listeners on the East Coast as well. And the book it's a really personal book. I actually published it anonymously, the first edition, before the pandemic, right before started, um, based on being not quite ready to like put my name on this story that had all of these, very personal stories in it about my life. I actually decided, some people that I was talking to about some of the editing said, maybe you should do a pseudonym or a fake type name. And I thought about that and it just didn't feel quite right. So I actually decided to just black out the name. Um, so on the cover, it's actually read it out. This is a copy of it here of the original. So you can see it's redded out, and then on the back, my um, image was blurred out, and I went through and I actually blacked out references to me and my family and stuff throughout the book, and that allowed me to be more comfortable putting it out there and sharing it. And I actually shared it with probably a couple hundred people and put it in some free little libraries, um, and it talks about my own experience with depression. I struggled with depression pretty severely in college, and then I've pretty consistently been in treatment since then, and have taken medication and had a lot of counseling, and thankfully have never been hospitalized inpatient, but I did have a bit of a breakdown a couple of years ago where just the stress of my life got to be too much, where it overwhelmed my coping skills, and I went to a psychiatric day hospital program, and that's the name of the book, The Day Hospital. And so I write about that experience, and then kind of reflect on some of the experiences of my life that have led up to it. And I also have a brother with a serious mental illness, and more severe than what I've been through, and that actually inspired me to get into social work and work to change the system, because he spent some time in jail and on the streets, and it was just pretty traumatizing to see all that he went through, and I've wanted to make a difference there. And then through COVID, I've been working with healthcare providers in our health system. So I run a service for people with that work for our 7-state health system, and we see a lot of doctors and nurses and social workers even, and environmental services folks and administrative folks, really anybody that could work across one of these 50 hospitals or 1,000 clinics, or in administration. And I talked to a lot of folks this year who were struggling with thoughts of suicide, and also we've lost some people, notably some physicians, to suicide.
Wow.
And I was part of the groups that debriefed some of their teams, and I got to the point where it was like, okay, I wrote this book. For one, I tried to promote it a little bit quietly, but it's really hard to promote an anonymous book without having your name on it, right? And so I guess I could go on podcasts with like a disguised voice or something, but so I learned that, and also the reception I had gotten from people that I liked and respected was really positive, and it actually led to some deeper connections with folks. I even shared it with some people at work, and I had the opportunity to just get a lot of good feedback. So I felt more comfortable, like, okay, this is a book that I can maybe share with a larger circle, and just decided to go for it. I added some additional chapters that talked about my experience during COVID, what it was like to get tested for COVID early in the pandemic, what it was like to stand with the first group of doctors and nurses that got the COVID vaccine. I got vaccinated back in, I think it was December, actually. I'm just looking at my card here. Yeah, it was December 18th. So it was my daughter reminded me it was historic back when we really didn't know what it was going to do to us.
Right.
And so I write about that, what that experience was like, and reflecting on what I knew was going on in the minds of these healthcare providers that I luckily have been able to work from home. So I've experienced it maybe in a kind of a secondary way, but I have friends and colleagues who were in the hospital every day and would tell me stories about coming home and going into their garage and stripping off their scrubs and wiping themselves down, going straight to the shower before they'd even, and this is before we really knew what was going on with COVID, and having this whole routine to try to keep their loved ones safe, and sometimes just totally isolating. And so it's really sad to me, kind of the way things have gone at this point, where people aren't applauding healthcare providers like they were, and also aren't necessarily doing the things that we need to do to keep the people that are working every day in the hospitals safe. Um, so
Yeah, absolutely. I know. No, I was living in New York at the time, and for maybe like a couple of months, 7 o'clock. I don't know how it started or why it started, but I'm glad they started doing that. But for a while, like March, like pretty much like March, April, kind of May, 7 o'clock, everybody started clapping and cheering, and for dedications to the healthcare workers. So without fail, 7 o'clock up. More certain communities did it louder than others. Like it wasn't in my neighborhood in the Bronx. They kind of heard it like kind of faintly, but my fiance who lived in Queens, they really went hard. With the clapping and the cheering, and then to a point like I even like let my fiance worked at a school for autistic kids in New York. She was doing remote as well. So both working remotely. I was still doing occasional emergency home visits, for the seniors that I was working with. But I ever told her like, you need to take a bow like every once in a blue, because we're both technically the essential workers, and I definitely like took my bow, and my son was like, "Why you? They're not cheering for you." I'm like, "I'm cheering for myself." Like I literally educate him like I'm an essential worker. Like I work with the seniors. Like come literally having many of our seniors, things up to I think I lost count of like 30 clients, passed away. From COVID, and I had a
I read
couple of other clients, due to like their age, and they already had like numerous health issues. So natural causes of passing away prior.
the isolation too, right? I've heard that it's
Kind of
really
like the
hard.
isolation, and it's just like with COVID, kind of like we were seeing clients pretty much on like an emergency basis coming into our clinic that we had, and getting checkups, but literally everybody just like somebody in the hospital, somebody passing away. Like our morning meeting, like we get more that morning email, somebody passed away. During the meeting, somebody passed away. Like late
Mhm.
afternoon, somebody passed away. There was just kept going, going, going. It was just a crazy, crazy time. And you mentioned the secondary trauma earlier. I think that's always going to be stuck with me permanently, in my work. And then after that, still dealing with the loss of my mom, during that same time frame as well. So it was just
Right.
from March, say like late February, all the way through August of last year was really like a hard time. September finally, like I finally saw like the end of the light in the end of the tunnel. But the whole summer last year was really crazy for for
Yeah.
me on a personal level. And my listeners, who diehard listeners, they know, like they would listen to the whole story from like season one, season two, and stuff like that. So it's just like you mentioned, like people fighting over about masks, and it's like I'm watching videos of school board meetings, and these parents are just like fed up with like the mask wearing, mask mandates in the school, and it's just like really like ridiculous. We're fighting over mask mandates, try to keep these kids safe, and keep and keeping our teachers and our staff safe as well. So it's
Yeah, I have a family member who's on a school board um, in the South, and that's been tough. That's a tough job. Yeah.
yeah, I can't even imagine. But it's like you said, like you said, one day at a time. Like we'll, you know. get get through this, and it's been hard for everybody. And it's not just and myself using those platforms just to give a social work mental health perspective of how hard it has been for the majority of us. Can't say like for everybody because everybody's situation is different, and not everybody had a bad experience. So it's just for those that did, like our stories, definitely need to be told, and whenever this pandemic finally decides the end, which is doesn't seem like anytime soon. It's important for these stories to be told, and for us, doing the work, and while during the pandemic, and still getting the secondary trauma while we doing the work that we get paid to do, and opening private practices, and other LLCs in other areas that we want to get into. So it's it's important that we take care of ourselves, and self care is not just a hashtag. It's definitely a way of life
Amen.
that we that we have to do this. It'd be something simple. Like, I'm looking forward to, as of this recording, this Friday, Madden 22 coming out. I'm definitely gonna be
All right.
playing my PS4 as a self care, and
Cool.
doing some reading. I'm trying to write a poetry book that's in the works.
Wow.
Finally, this summer, trying to hopefully finish it up, so and release it sometime in the fall, so that that's in the works. That's been part of like my self care and writing about whatever popped in my head from like March, April of last year. Then after like my mom passed, and all the way through like a little bit recent stuff. So it's that was definitely therapeutic for me, and
Good.
my my way of self care, since no gyms were closed, and then I try to go back to the gym, and it's like, and then they lifted the mask mandates for gyms, and it was like I was still wearing my mask, and I was like the only one and doing a Zumba class with a mask on,
Yeah.
and it's like, and I kind of like stopped going all together. So it's
Right.
just it's hard with this Delta variant, and then this other variant, and not a lot of people want to talk about for whatever reason. So
Yeah.
it's a lot of stuff, and me working in the school system is so I got like the double whammy of like worry about my kids, and then worry about myself, and worry about everybody else's kids, like
Yeah.
whether they got it, we gonna close down, or what the heck we're doing this fall. So
Yeah.
it's a lot of
It's a
uncertainty.
lot. Oof. Yeah, it's a lot. It's a lot. Well, and my book, part of what I wanted to do is to be able to kind of lift the veil on that we mental health professionals, we go through our own stuff too.
Hmm.
And I think a lot of people that know me, even that I shared the early version of the book with, that knew me professionally, didn't have any idea that I'd been through all of this and that I struggle with this every day. I have a pretty strong mask. I even thought, well, I should write an article called "Under the Mask" or something about it. Might write a blog post, who knows? Um, but but that's really kind of what this is about, of humanizing, that you can be a professional and also struggle with these issues, and be a successful person and struggle with these issues. And I was before, and I came out the other side, and actually, if I hadn't gotten help, I think, or things hadn't gotten bad and I hadn't had to get help, I'd probably be doing worse than I am now, where I had a bit of a crisis, which turned out to be an opportunity to really slow down, get the support that I needed.
Hmm.
And now my family is doing a lot better than when I was just kind of hanging on. And we're we were able to buy a house, which back then I really felt like, how's that ever going to happen? I've been able to work hard and get my income to the place where I'm feeling a little more comfortable, maybe even watch some of those shows you've been watching. and and so I have so much to be grateful for, and I acknowledge that I have a fair amount of privilege. um, but I think if people are considering getting help for mental health challenges, even as a professional, and we social workers, sometimes we've been around the system, we've seen what there is, and we're like, I wouldn't want to go into the psych hospital, or I wouldn't want to go to a treatment provider because I know what that's like, and I'm gonna sometimes we can be the worst patients for ourselves. And I work with a lot of doctors. I'm their counselor, and they sometimes joke that they're the worst patients. And so it's okay to reach out for help and to take a risk and to explore, what options might be available. A lot of us got into this in the first place because we had some issues, and maybe we got help, or a family member had some issues and we wanted to make some changes in the system. um, and we're doing that, but we got to still take care of ourselves, because sometimes it can be easy to get pulled into all of the need and suffering and get drowning in that and feel like, well, I'll just keep taking care of everybody else and not take care of myself. Well, that's not
Yeah.
sustainable at all, and that's not a lasting going to be a lasting career, and that doesn't do anybody any good in the long run.
Yeah, yeah, of course. It's just the longer you've been in the field, you kind of see more stuff, and it's just like there's just stuff you see and stuff you hear, and I worked in foster care, and I see a lot of crazy stuff in foster care, and just like the lingo that we speak in the foster care system, to speak to an outsider like that, they're like, "The heck are you talking about?" Like talking about the birth parent, and then the foster parent is like, "Why you talk like that?" Because that's that's how we speak, and
Yeah,
when
yeah,
we're talking to our peers and like supervisors, directors. So from there, I'm working with the severely mentally ill and going to the state hospitals, seeing clients in the state hospitals, or they get hospitalized in the regular psych ward, and going to see them in there and just seeing what a ward actually looks like
yeah.
and
I've been
entails,
there.
and
Yeah,
and doing that. So working I used to work with HIV and AIDS adults, and like scatter site
yeah.
housing, and trying to looking for housing in New York City. It's like
Wow.
this was like 2010, 2011. Is
Yeah.
I can't really imagine trying to do that work
Wow.
now
Yeah.
with New York City politicians, and their definitions of affordable housing is like
Wow.
it's not.
Yeah.
And the way this housing market is just throughout the country has been insane. So can't even imagine. Like we're definitely going to be seeing more and more homelessness, unfortunately.
Yeah.
Uh, and I we're not ready as a country to deal with that, and then it's coming for all the social workers that deal with that. That's definitely coming very very
Yeah.
soon.
Yeah. Yeah. Um, and I think social work has an opportunity to lead here, and our training prepares us not just for these direct service roles where you and I spend a lot of our time and have come up, but we've got social workers that are in politics, that are
Mm.
in leadership roles, and we're trained to think systemically, and about policy, and in addition to the individual psychology. I love the kind of ecological systems perspective and looking at the whole system. And when I'm walking around seeing homeless people, typically I'm not thinking about, oh, what a loser. I think about what a failure by our society, and what can we do systemically to start to make a difference. And so I think there's a real opportunity for social workers to speak up for what we know to be better solutions that are being offered by the business community, or by politicians that don't really understand this stuff, or frankly by the medical community that doesn't necessarily always understand mental health.
Mm-hmm.
having worked in big healthcare. And social workers are the biggest group of mental health professionals in the United States and potentially in the world. I'm not sure, but I think there's a great opportunity for us to, stand up for a more, just and equitable system, because what we've got right now is certainly not working.
No, it's not, and it's not just a Democrat Republican thing, because it's been
Yeah.
going on
Oh my gosh. Yeah.
for so long, and I've been in the field since 2002. Like, there was like GW Bush was president, so look what we got now, and it's
Yeah.
like nothing's really changed. It's things that when it keeps going up and down, and it's kind of like now we're back to like almost like square one from like when I started in the field, and with COVID, and COVID has not helped situations at all. Like, it's just,
No.
I mean, it helped in a way that it's kind of like you mentioned earlier, is that we like the disparities in what we're seeing is come up, like is up to the forefront. No, like, and then people are kind of like recognizing that, well, this has been going on, like, and our social workers are like, where have you been? We be dealing with this like for a long time now.
Yeah.
Now you want to
Yeah.
talk about it, so it's like,
Yeah, definitely democratized suffering, and people are more willing to talk about, I'm struggling, and man, this time is rough for everybody. And
you
so,
want to be inclusiveness, and not be racist and all this stuff, and having
yeah,
DEI systems like that wasn't even
yeah,
talked about, not even like
yeah,
2019, 2018.
right,
Unfortunately, it took
yeah,
Breonna Taylor, George
yeah,
Floyd murder to be talking
yeah,
about this stuff. Like, come
yeah.
on, man, this is
Well, and social workers have been working on this stuff. It's a good point. That yeah, like yeah, yeah, all these people reading these books that I read in grad school, and it's just like, yeah, get with it. Like this is not new. Yeah, this is needed to change. I mean, I'm glad there's been a more of an awakening, but we've got to continue it. And so yeah, I hope social work can continue to be a big part of that. And I'm glad you've got a voice that is getting out there in the podcast airwaves, as it were.
yeah. I'm just you know realizing, using a voice and using the podcast to network with other, professionals, like yourself, and just seeing what are the similarities, what are the differences, that's going on, that's not being talked about, on the news, on your local news, or like it's not going to be talked about, or like, or CNN or Fox, or you're not really going to be seeing too much about that, or on the Instagram and the Facebook, or Twitter, any other social platform. Like, just what's like underneath, what's like the underground, what's going on, like,
Yeah,
no, locally, and how can, like, we, have these conversations, and what can we do to address, or just something simple, like, you're promoting your book, and it's important, talk about that, and like, yes, I may have an issue, but I'm still, able to provide a service and doing what I need to do, not only for myself and my family, but at the same time, do I need to do to try to make a difference in my profession. So, kudos to you. Um, where can people find the book?
so they can get it on Amazon.com is probably the easiest way. It's in some local bookstores out my way, but yeah, Amazon.com. Just type in The Day Hospital by Josh Cutler. There's a couple versions. So there's one that's kind of like a prescription bottle that's yellow that has the name blacked, or redded out actually. That's the first edition, and then the second edition's got more of a pill bottle with some pills on it. But look for the second edition. But the first edition is pretty good too. So they're both available there. It's also on Kindle if you read books that way.
All right, awesome. So, any goals, or objectives for the rest of 2021? Can't believe this year is like flying by.
Well, I joined a gym, and for a little while I was focused on losing weight. Now I'm focused on getting stronger. And I feel like that's the right focus for me right now. Like able to do more push-ups. I just noticed I'm feeling a little stronger. I don't feel like I'm going to quite die after an intense workout session now. So that's definitely one, and working to find a little balance. I worked way too much over the holidays last year, and so this year I'm looking forward to spending more time with my family over the holidays, and then we'll see what next year brings.
Yeah.
2022, maybe the golden year.
Yeah, hopefully. No, I was looking to fall's like my favorite type of season. Just
Mine
in
too.
just in terms of like, I'm really into sports. So it's just like started the football season. There's baseball playoffs. There's like NBA preseason. All this stuff going on. College football, college basketball. On the verge of starting, and since I moved, I'm only like an hour and change from Philly. So Philly's like got all these college teams and stuff that I wanted to go check out, and even the local high schools, supporting them with their sports teams, and just Delta is like ready to like mess everything up, and it's
Yeah,
like
yeah.
and it's like yeah, vaccines are helpful, and boosters are helpful, but who only the science knows, or only God knows the ultimate plan with Delta.
Yeah.
Like my next door neighbor, he got vaccinated. He's already had, I think, it's like Delta like twice already. So it's just like,
Wow. Well, yeah, masking and distancing is still so important, but I'm glad to hear that he's okay. I mean, that's the
yeah.
big thing. You don't get as sick. So,
Yeah, yeah, absolutely. And people like need to like social distance again. Is just like
yeah.
they tuned that out. Like I went to the supermarket, and it's like somebody was like really like behind me, like putting their stuff on,
Hmm.
on the counter, getting ready to pay. I'm like, I haven't even paid yet. Why you like right behind
Right.
me? And I
Right.
wanted to say something, but I was like, people just
Yeah.
act so stupid nowadays. I'm gonna get into a fight for somebody's stupidity.
Yeah.
So
For sure. For sure.
well, thank you so much for coming on the podcast.
Thanks for having me. This is
No, no.
great.
I'll talk to you soon. Have a good one.
All right.